Chinese people's views on the lockdown epidemic prevention policy. Introduction. The COVID-19 pandemic led to an unprecedented global health crisis and brought drastic changes to the lives of people all over the world. In response to the pandemic, several governments implemented lockdowns and other epidemic prevention policies to contain the spread of the virus. In China, the government implemented a strict lockdown policy in the early stages of the pandemic, which involved the isolation of individuals in their homes, closure of public spaces and transportation, and travel restrictions. This research project aims to explore Chinese people's views on the lockdown epidemic prevention policy. The research project is particularly relevant given the significant impact of the policy on the lives of Chinese people and the global interest in the Chinese response to the pandemic. Empirical and epistemological approaches. The empirical approach refers to the methodology we, as the researchers, shall use to collect and analyze data for the research project. In this case, we plan to use a mixed methods approach involving quantitative and qualitative data. Quantitative data refers to data that can be measured numerically, such as survey responses, and can be analyzed using statistical methods. Qualitative data, on the other hand, refers to data that cannot be measured numerically and is usually obtained through open-ended questions or interviews. Qualitative data provides insight into people's experiences, attitudes, and beliefs. In our research project, the quantitative data shall be collected through an online survey, which shall allow us to reach a large sample of Chinese people. The survey should be designed to collect data on participants' views on the lockdown epidemic prevention policy, including their attitudes toward it, compliance with it, and perceptions of its effectiveness. On the other hand, qualitative data shall be collected through interviews with a smaller sample of participants. The interviews shall provide a deeper understanding of participants' views and experiences regarding the lockdown epidemic prevention policy. The epistemological approach refers to the researcher's underlying assumptions about the nature of knowledge and how it can be obtained. In our research project, we shall adopt a social constructivist epistemological approach, which recognizes that knowledge is constructed through social interactions and is influenced by individual experiences and perspectives. This implies that we, as researchers, acknowledge that knowledge is not objective or absolute, but is shaped by social and cultural factors. By adopting a social constructivist approach, we recognize that participants' views on the lockdown epidemic prevention policy are influenced by their individual experiences and perspectives shaped by their social and cultural contexts. The qualitative data collected through interviews shall allow us to understand these individual experiences and perspectives more deeply. Methods, dataset, and samples. We shall use a mixed methods approach to collect data from Chinese citizens. The study shall use an online survey and semi-structured interviews to collect data from participants. The survey should be administered using a Google form, and the link to the form shall be shared with the participants through social media and messaging apps. The survey should contain closed-ended questions, such as multiple choice and open-ended questions, to collect quantitative and qualitative data. For the interview phase, participants shall be recruited through a snowball sampling technique, where participants who complete the survey should be invited to participate in an interview. The interviews should be conducted through online video conferencing tools, such as Zoom, and shall be audio recorded with the participants' consent. The interviews shall be semi-structured, allowing participants to provide detailed responses to open-ended questions. Also, we intend to conduct the interviews in Mandarin, the primary language spoken in China, to make sure that the participants understand the questions and also for them to express themselves efficiently. Quotes from corpus or interview transcripts. The following is a potential quote from an interview with a Chinese citizen regarding the lockdown epidemic prevention policy. The lockdown policy was necessary to contain the virus, but it was very difficult for many people. I think the government did a good job of informing us about the policy, but it was hard for people to stay at home for such a long time. It was particularly hard for families with children and elderly people who needed care. The policy had a huge impact on people's lives, but it was necessary to stop the spread of the virus. Limitations of the methodology. One limitation of our research study is that the sample is limited to a specific group of Chinese citizens with access to the internet and social media. This could be problematic in terms of generalizability, since the views of those who are not as active on social media or who have limited access to the internet may differ from those who are more active on social media. As such, the study's results may not be generalizable to the larger population of Chinese citizens. Furthermore, our use of snowball sampling as a recruitment method for participants may also result in a sample that is not representative of the larger population of Chinese citizens. Snowball sampling involves asking participants to recruit other potential participants, which may lead to a biased sample if participants only recruit those with similar views or backgrounds to their own. This could limit the generalizability of the findings, as the sample may not be representative of the larger population of Chinese citizens. Positionality. Positionality refers to the idea that a researcher's personal characteristics, experiences, and biases may impact the research process and findings. The issue of lockdown epidemic prevention policy is a politically sensitive topic. For instance, our political perspectives may influence our interpretation of the data collected. Different political tendencies and positions may have different attitudes towards the anti-epidemic policy, and this can affect how the data shall be interpreted. We acknowledge that our positionality can introduce bias in the study. To mitigate this, we shall attempt to remain objective and impartial throughout the study by analyzing the data collected without preconceived biases. Additionally, we shall seek feedback from colleagues to ensure that our positionality shall not affect the findings of the study. In addition to political tendencies, other aspects of our positionality that can impact our research on the lockdown epidemic prevention policy include our age, socio-economic status, race, and cultural background. For example, among us, there are those who have experienced the economic and social impacts of the lockdown at a personal level, thus may interpret the data differently than someone who has not been as affected. Similarly, one of us come from a community that has been disproportionately impacted by the epidemic and may have a different perspective than us who does not. Also, we as the researchers are engaged in different industries where we experience various levels of impact in terms of epidemic influence. For instance, one of us is committed in a civil servant job where he receives a salary despite of others being affected in terms of income, such as in the tourism and hotel industry. To address potential biases, we shall take several steps, such as acknowledging our positionality and actively working to mitigate its impact on the research process. In addition to seeking feedback from colleagues, we shall also engage in reflexivity, by reflecting on our own assumptions and biases throughout the research process. We shall also use multiple methods and sources to triangulate our findings and minimize the potential impact of anyone's positionality. By taking these steps, we shall ensure that our research is as objective and impartial as possible, even when studying politically sensitive topics. Ethical considerations. Ethical considerations are paramount in any research project involving human participants. In our research project, we shall take several steps to maintain ethical standards. Firstly, participants shall be informed about the nature of the study and their rights as participants. This is important to ensure that participants are fully aware of what the research entails and that they are not coerced or misled in any way. Secondly, participants shall also obtain informed consent before participating in the study. This means that participants shall be given the opportunity to review the study's aims and procedures, and they shall have provided us with their consent to participate. Thirdly, it is important to acknowledge the potential political risks associated with expressing dissatisfaction with the anti-epidemic policy in China, which is a country with a one-party system. Participants may be hesitant to provide honest responses for fear of retribution or other negative consequences. As researchers, we shall create a safe and confidential environment for participants to share their views, while also being mindful of the potential risks that they may face. In order to mitigate these risks, we shall assure the participants that their responses shall be kept confidential and anonymous, and that their participation in the study shall not be shared with any outside parties. Additionally, we shall take caution to ensure that the data is stored securely and accessed only by authorized personnel. Any potential political risks shall also be discussed with the participants prior to their participation in the study, and they shall have the option to decline or withdraw from the study without penalty.